we're super pumped today to have Dr. Jenn Pilon with us. She is an ND. I'll let her explain what that is. That works specifically, well, not just with women, but that's one of her areas of interest, and one of her areas of expertise is working with women and hormones. Mm-hmm. So we are going to talk all things periods today. I could, if I had a quarter for every time someone asked me about their periods, I'd be rich.
Not as rich as I am.
True.
Close, probably.
True. Yeah, totally. Plus, I have so many questions about this, and I mean, it's one of those things that are always changing, your hormones, and so I feel like this is going to be a really awesome interview with lots of really good information. So grab a cup of tea and let's dive in. Jenn, why don't you introduce yourself and tell us a little bit about what you do and where you work and that kind of thing.
Yeah, so my name's Jenn Pilon. I was born in Manitoba, but I basically grew up in Red Deer from the time that I can remember. So Red Deer, Alberta is home for me.
Awesome.
And I am a naturopathic doctor. So I'm from Red Deer, and I finished my degree through Thompson Rivers University, which is in Kamloops, in biology and human nutrition. Yeah. And then after that, I went to Seattle to go to Bastyr University. So there's several different accredited naturopathic medical schools in the States, and there's 2 in Canada. So I went to Bastyr for 5 years. And
Which is a super, it's one of the, like, it's the best.
Yeah.
It's the best school, for sure. Yeah.
So, yeah, definitely has a good reputation, for sure. And so that's just outside Seattle, Washington.
Cool.
And while I was there, I managed to get married and have a baby. And do a residency. So yeah, it's been busy.
Yeah, totally.
Yeah. And then I practice at Aspire Natural Medicine, which is in Red Deer, Alberta as well. Yeah. And what I do there is I have just really a general naturopathic medicine practice. So I see people with all different kinds of chronic and acute health complaints. Yeah. But the main thing that my practice tends to focus on is women with struggles with hormones, periods, fatigue, and mood concerns. So those tend to be the people that find their way to me.
Awesome. Yeah. And Jenn is such a great resource for our community, and that's one of the reasons I wanted to just have her on and interview her, because she really is very knowledgeable in this area. So we're going to dive right in.
Yeah.
We're going to talk about periods.
Okay.
Yeah. That word alone can stir up lots of the feelings, both the good and the bad. I think, I'm going to get you just to start us off with what I guess, like, normal periods, cycles. Go for it.
How it all happens.
How does it happen?
Sure.
What's at play here?
Yeah.
Give me the lowdown.
Yeah, so I think we're going to have a graphic for people to be able to see, correct?
Yeah, I will post that.
Okay.
I'll actually post that at maybe partway through this video, but also at the end.
Okay.
And I'll also put that on our Facebook. Yeah.
Perfect.
So, yeah.
Perfect. Yeah, so you'll see a lot of different things in that graphic, and basically the gist of it is that it's pretty complicated what happens hormonally that results in a menstrual period.
Okay.
But ultimately, it's all designed around encouraging a pregnancy.
Okay.
Right? And the results of what happens if you don't have a pregnancy that happens during that cycle.
Okay.
So I think the thing that often gets forgotten when we talk about periods is that your brain is actually the master control center for what happens with your hormones. So your brain sends signals to your ovaries that tell it to make estrogen, make progesterone, all of these different hormones that we think about. Okay. But a lot of the time, the problem when there are problems is not actually in the ovaries or in the uterus. Okay. It's in the signals that are coming from the brain or in the communication between the brain and the ovaries.
Okay.
So when we think about a menstrual cycle, just to kind of orient everybody, we're usually talking from day 1 of a menstrual period until the next day 1 of a menstrual period.
And so day 1 is the first day that you're beginning your flow.
Yes. So day 1 is the first day of a true full menstrual flow. So if you have premenstrual spotting, that doesn't technically start your period until the first day of a true flow. Okay. And sometimes that's confusing because women have really light periods.
Right. Yes.
But yeah, so when we talk about the menstrual cycle, we're talking from day 1 to day 1. Okay. And then we talk about the menstrual period, we're talking about the actual days of bleeding that occur.
Okay.
So basically what's happening is that in the first phase of the menstrual cycle, which is called the follicular phase, that runs from day 1 of your period until you ovulate or release an egg from the ovary.
Right.
So during that time, your estrogen levels are slowly rising, but overall your levels of estrogen and progesterone are pretty low.
Okay.
And what's happening in your ovaries is there's a whole bunch of, they're called follicles, which are little immature eggs that are developing at that time. So eventually one of those gets selected to be the egg that is going to get released. And your estrogen levels are slowly going up because of the cells in the ovary are making that estrogen.
Okay.
And then right before you release an egg, there's a surge of a hormone called LH that comes from the brain, or luteinizing hormone.
Okay.
So that hormone causes the ovary to release an egg, and that's called ovulation.
Yeah.
And that LH is actually what you can measure, like on an ovulation predictor kit strip that you can get from the drugstore that tells you when you're ovulating, when you're fertile.
Okay.
So once an egg has been released, then we start the second part of the menstrual cycle, and that's called the luteal phase. So the reason it's called the luteal phase is because this little sort of sac that's left over in the ovary from where that egg used to be is called the corpus luteum.
Okay.
And that's actually what makes progesterone. So the role of that progesterone is to maintain that nice thick lining of the uterus that all of the estrogen has produced during the first phase, in case you get pregnant.
Right.
So that there's this nice juicy forest for the baby to draw nutrients from.
Okay.
And that kind of brings us to a key point about the menstrual cycle that I think is often misunderstood, is that you have to ovulate in order to make significant amounts of progesterone.
Great point.
Yeah, so if your adrenal glands do make some progesterone, but your ovaries make most of the progesterone that you'll produce in your lifetime.
Okay.
And if you don't ovulate, you don't have that corpus luteum, so you don't make much progesterone that cycle.
Can I just interject for a second, and can you let us know why progesterone is important?
Sure.
Like, if you're not getting pregnant, if pregnancy and not maintaining a pregnancy or having a baby is on your radar, why is progesterone important?
Yeah, so when we think about progesterone, we think often about its balance with estrogen. So estrogen tends to be thought of as more what we call a proliferative hormone, so it causes things to grow and cells to divide. And progesterone kind of calms down that process a little bit. It's the calming, sort of balancing cousin of estrogen.
Okay.
And so when we think about things like long-term cancer risk, if women aren't ovulating, we know that having a lot of estrogen around without that balancing progesterone can increase your risk of like uterine cancers and ovarian cancers in the long run. Your risk of getting those things is still low.
Right.
But it does slightly increase that risk.
Okay.
And then also just from the perspective of symptoms, estrogen tends to be really activating. So it affects our brain in a way that causes us to be more sort of aroused, more awake, can sometimes cause women to be more irritable and have more mood issues.
Okay.
And then progesterone generally tends to calm those things down a little bit. It helps with sleep, and it just helps our body to relax a little bit.
Okay.
So sometimes if women are just not ovulating, they can struggle more with those mood issues. Or sometimes if they are ovulating but not making a lot of progesterone, they'll have more of those kind of annoying, irritable PMS type symptoms. Not sleeping, maybe some breast tenderness. Yeah. So that's why progesterone is important.
Okay.
Yeah.
Takeaway tip. Making notes on that. Awesome. Is there anything else you wanted to say? We were just talking about just an overview of the menstrual cycle, or
Sure.
you good?
I guess the other thing probably that's important to know is that what actually produces a bleed, essentially.
Yeah.
So that corpus luteum only lasts for about 14-ish days.
Okay.
That's pretty stable in most women.
Okay.
And so once that little guy kind of goes away and doesn't produce progesterone anymore, then there's nothing around to kind of stabilize and keep that lining in the uterus, and so it just sloughs off.
Okay.
There's also more of an inflammatory process that is involved around that time, actually similar to what happens with the initiation of labor. So different hormones called prostaglandins that are necessary for you to have a period, and sometimes that's why women get a lot of pain and cramping.
Definitely.
But yeah, that's what causes the actual bleed.
Yeah.
Yeah.
Awesome. And then we're back to
then you're back to day one.
Back to day one again, and it starts all over again.
Yeah, totally.
Awesome. Okay, that was a great overview. Is there a normal when it comes to periods? Because I guess that's a huge. There's a lot of fear, I feel like, or just maybe just a not fully understanding, which then creates fear, which then people are like, oh no, is this normal? Is something I hear a ton. Is there a normal period?
Yes.
Okay.
But there's variation within normal.
Okay.
And I think we do always need to remember that when we're talking about normal, we're sort of talking about a bell curve. So there's going to be some people who their normal is outside of what most people's normal is, but that doesn't necessarily mean that there's a problem.
Okay.
So typically we think about the full length of that cycle from day 1 to day 1 as being between 28 to 35 days is typical. That's what most women's menstrual cycles are in terms of length, but some women's are shorter. Yeah. And some women's are consistently a little bit longer. Right. So we do also look at whether it's consistent and kind of what's going on with your other symptoms to determine whether that's normal or not. Are you having trouble getting pregnant, that sort of a thing. Yeah. Generally anything less than 24 days is what I would consider to be quite short. Okay. And anything longer on a regular basis than 35 days, especially if it's really irregular. Yeah. So if you're having, periods every 36 days and that's normal for you, then that's probably normal for you and that's okay. But especially if it's really long between and it's irregular, then we'd be concerned. Yeah. Or we just want to figure out what's going on. Right. Yeah. And then the other thing too is like the length of bleeding. So generally 3 to 7 days is the most common. Okay. Anything longer than 8 days kind of raises a red flag for me in terms of women potentially losing more blood than is good for their body. Yeah. And anything longer than 3 days always makes me question like, shorter than 3 days. Yeah, always makes me question like just what is going on hormonally, but it's not necessarily a problem. Right. Yeah. And then sometimes people have questions about like the average volume of blood loss. Yeah, because some people like feel like they bleed a lot, like excessively, and yeah. So when we think about that in terms of medical terms for what is excessive blood loss, the technical definition is anything more than 80 mils in a period. So if you can soak more than 16 tampons or regular pads during your period, your entire period, then we'd say, yes, that's what we call menorrhagia, which is the medical term for a heavy period. Yes. But really it's more about the woman's subjective experience of how much blood loss they're having. Right. And also it's about the total duration of bleeding. Yes. So if you're bleeding really, really heavily for 3 days, that can be enough to cause somebody to become iron deficient. Yeah. And if you're bleeding a little bit more lightly, but for 8 or 9 days, then same thing. Right. So we really think about just kind of that total volume of blood loss. And we also do things like look at your iron status if we think you're having heavy bleeding with some blood labs to tell us, are you deficient in iron? Like, is this affecting your body in a negative way? Yeah. And of course, it's affecting you symptomatically in a negative way, and it's disruptive to your life if your bleeding's really heavy. Yeah. Yeah. And there are some other problems like iron deficiency actually and thyroid issues that can cause your bleeding to be heavier or longer. So we look into those for women too. But so technically, like, if you're soaking a regular pad every 3 to 5 hours for a couple of days, that's probably normal. If you're bleeding through a tampon and a pad every hour to 2 hours, or you have to double up on a Diva cup and a pad at night, like a big heavy pad, like that's probably not normal. So generally I find women have a pretty good sense of whether they're bleeding too much or not. Definitely. Yeah.
So if someone was consistently having a heavy period, that would be something to probably get checked out.
For sure.
Yeah.
Yep.
Yeah, definitely.
Yeah.
I also wanted to touch really briefly when we're talking about kind of normal, abnormal on pain and pain with really heavy or pain with periods. Did you want to touch on that? I'll probably also take take a turn on
yeah.
that one.
I'm sure you have being a pelvic physiotherapist.
Yeah.
I'm sure you
Why
have
don't
your
you
own
go on
opinion
that
there.
one? Yeah.
So I think really when it comes to pain with periods, it's similar to how we think about like pain during labor.
Right.
Some women have painless labors.
Who?
And so, which
Who
I'm like,
has
I
that?
don't, maybe I've never met them.
I've never
but
met
I've heard
anyone.
stories of them.
I've read stories.
I was not
I've
personally
never
one
heard
of them.
them.
Yeah.
No. Anyway.
But so I think it really all has to do with how your brain copes with pain, right?
Okay. Yeah.
And so sometimes women do have sort of histories, either sexual histories or some sort of traumatic history, sometimes can make pain worse for women.
For sure.
And sometimes if there's an out of control inflammatory process going on in the body, where there's just tons of those prostaglandins that we talked about being produced, that can make pain and cramping worse.
For sure.
But the normal process of having a period does involve contraction of the uterine muscle, and it does involve those hormones, those prostaglandin hormones. And so I tend to think that really pain becomes a problem if it's affecting your ability to cope in your everyday life.
Mm-hmm.
If you have to stay home from work
Mm-hmm.
because of your pain, or if you can't walk because of your pain, or if it's not being controlled by like 1 or 2 doses of ibuprofen, then we really do need to talk about what's going on here, because there are some underlying problems that can cause worse menstrual pain for women.
For sure.
Yeah, and some of those we can do something about.
Yeah.
And some of them are just issues with the actual uterine muscle that are sometimes harder to do anything about. So yeah, it's worth looking into though if the pain's really disruptive. What's your opinion on that?
Yeah, I would echo everything that you just said. I would echo. Joelle and I usually say if the pain cannot be controlled with Advil, kind of the normal dose of Advil once every 4 to 6 hours for 2 days. If it's more than that, then it does need to be checked out. And the part of the reason behind that is because it begins to change the nervous system, right? So if someone is having pain every month for their 30 years, then your body begins to then have anticipatory responses. So even from like the muscular, the pelvic floor, we're looking at that. The nervous system becomes hot, like just becomes quite sensitive to that stuff, and then you can end up with a persistent pain issue, and which tends to kind of then overflow into other areas and other pain issues in the body. So definitely worth getting that checked out for sure.
Yeah, definitely just breaking that pain cycle is important if it's getting out of control.
Yeah, for sure.
Yeah.
Okay. What are some kind of day-to-day things that can affect a woman's cycle?
A lot. There's a lot of things, depending on kind of what you consider day-to-day.
Right.
So I think probably the most common that we see is birth control.
Yes.
So birth control obviously is designed to cause you to not be fertile. Right. And the way that the hormonal birth controls do that is generally by preventing you from ovulating.
Yes.
And so sometimes women, when they're on birth control, they'll notice that if they take their placebo pills for a week, they start having less bleeding over the long term. Sometimes they'll notice that initially they have some spotting or some irregular bleeding. So that's definitely pretty common. Also age. Okay. So for the first 5 to 7 years after you start getting a period, it's really common for things to be pretty irregular, just as your body is figuring out that process of having regular menstrual periods. So having irregular periods when you're 14, 15, 16, while it's really annoying to not know when you're going to bleed and can potentially cause some pretty embarrassing situations, it's normal from a medical perspective.
Okay, that's good to know.
Yeah.
Lots of questions from moms about their daughters.
Yeah. And obviously there's caveats there about like, well, how irregular and whether kind of symptoms are there and all of that, but generally it's normal for things to be a little bit wonky at the beginning. Yeah. And then they're also wonky at the end. So as perimenopause approaches, you just don't ovulate as regularly, and so things get a little bit more irregular in terms of your periods. They can get heavier, they can get longer, they can get shorter, they can just come more or less frequently than you're expecting. And then we're going to talk, I think, about pregnancy and breastfeeding. Yeah, we are. And another question that's coming. Yeah, that of course affects it. Yeah. And then I also see stress, and by stress I mean any type of stress. So emotional or an actual physical stress on the body can affect periods.
Yes.
Anything that sends your brain the signal that this is not a safe place or time for you to carry a baby will essentially delay or prevent you from actually ovulating.
Right.
And so really intense emotional stress, long-term emotional stress, or even things like really rapid weight loss or significant calorie deprivation can cause issues for women, just because the female hormonal system is really sensitive to these starvation signals, we call them.
Totally. Yeah.
So if our body is not healthy and not able to give from a place of fullness, then the first thing that kind of goes away is our ability to reproduce.
Yeah.
And that'll manifest itself in our periods being
I think
a little wonky.
Yeah. Some of those other physical stressors might also include just like even toxic environments. So
yeah, for sure.
Things that, because there's a lot of, and maybe you can touch on this, but things that would disrupt possibly the hormone balance as far as chemicals in the environment, fragrances, like all that kind of stuff, as well as when your body is really working super hard to digest some foods, even could be another like physical inflammatory thing that would make it feel stressor, I guess, that would make it feel not super safe.
Yeah. So we think sometimes about things we see in our environment that are called endocrine disruptors.
Yeah.
And that basically
touch on that a little bit?
So that basically just means that they affect our hormones.
Yes.
And a large way that they do that is by sort of acting a little bit like our hormones, but not exactly like our hormones. So it's just enough to throw the body off.
Yeah.
So things like parabens and phthalates and personal products and some pesticides have been linked to being endocrine disruptors. There's a lot of nasty stuff in some sunscreens actually that can be a problem.
Yeah.
And so when I look at that for women, I'm really looking at, like, is there sort of a cumulative large dose of these things? You know, are you slathering your body in endocrine disruptors every day?
Yeah. And then sleeping in sheets that have been slathered in it, and going into your bathroom and washing your hair and your whole body
and going into a workplace that's full of perfume, and so I think really, like, I don't want to sort of cause any fear around those things, because while we know from a population perspective those can potentially cause problems, it's always hard to tell in any individual person whether that's actually a problem for you. And so it's something that I just sort of recommend that women know about and that they be moderate about. And I always talk to my patients about living an estrogen friendly lifestyle. So just making sure that you're not surrounded by unhealthy chemicals and that you're eating in a way that allows your body to have an optimal hormonal balance. Yeah.
That's great advice. Yeah. Okay. Let's talk for a second. I feel like we've kind of done that. Let's talk for a second about two common conditions that we do see that tend to affect people's periods. One is PCOS, which is polycystic ovarian syndrome, and the other is endometriosis. We're not going to dive into like massive detail because we could do a separate interview about each one of these things. But I think it's worth noting in this conversation about how periods might be different or how those syndromes would affect people's periods. Do you want to talk about that?
Yeah, for sure. So PCOS, or polycystic ovarian syndrome, is called a syndrome because it's a cluster of physical signs and symptoms that tend to come together. So medically we talk about a syndrome as something where we just kind of see all these things go together, but we're not quite exactly sure what's causing it.
It's like an umbrella term.
It's an umbrella term.
Yeah, for sure.
And as a naturopathic doctor, I do see it truly be an umbrella term. Like there's a lot of different issues that women can have that go on there. But so to get a diagnosis of PCOS, there's a few things that we think about. One of them is either too much testosterone in the blood or signs in the body of too much testosterone. So the most common one of those would be sort of more male pattern of body hair growth. So really increased hair growth around the chin or on the chest or back, or sort of more of a male pubic hair pattern growth. Sometimes women also see like acne along the jawline be a big problem when they have too much testosterone. And then the other thing that we see is either irregular periods or no periods. That's kind of one of the criteria. And then Also, we see potentially if women get an internal ultrasound done where they actually look at the ovaries and the uterus, there's certain findings on that that are characteristic of PCOS, just reflecting the fact that the ovaries are not really selecting one of those follicles like we talked about. There's kind of a whole bunch of little ones, but that often is not present.
Yes.
So you only have to have 2 out of those 3 things to technically be diagnosed with PCOS.
Yeah. I think it's worth noting that some people who have a history of ovarian cysts think that that could be an indicator for polycystic ovarian syndrome.
Sure.
And actually what Jen was alluding to there was if you were to look on ultrasound at the ovary, there's a lot of those little immature follicles. So remember when she talked initially about the menstrual cycle, PCOS would be that one is not, like you said, not being selected. So there's almost this like string of pearls look. So it doesn't have to do with actual ovarian cysts.
Yeah, so they're different from the type of ovarian cysts that would like become really big and cause a lot of pelvic pain and potentially rupture.
Yes.
That's
just a note.
Yeah, that's a very different scenario.
Yes,
for
totally.
sure.
So that's it's not usually related.
Yeah,
the two. So.
They can overlap.
They can.
Unfortunately,
they can.
You can have both.
Yeah,
but,
they can.
But yeah, they don't usually. I don't find.
Yeah.
Yeah.
Do you want to touch for a second on endometriosis?
Sure. Yeah. So what endometriosis is again a little bit of a medical mystery. So. The endometrium is the lining of the uterus, the innermost lining of the uterus. That's what we name it. And so endometriosis occurs when we get little bits of that endometrial tissue in other places in the body. So the most common place that we see that is in the pelvic cavity and in the abdominal cavity. But in some cases it can be in really kind of bizarre places.
Totally.
And in those cases, we're really not sure how it gets there. We do think that when it's an abdominal or pelvic cavity, that it's probably due to what we call retrograde menstruation. So maybe some of the tissue that's released during a period goes back up those fallopian tubes and out into the abdominal cavity. That's what we think.
Okay.
So what happens is they're called implants. They can happen on a variety of different organs, and then they cause symptoms in those organ system. So if you have implants on your bowel, on the outside of your bowel, that can cause pain with bowel movements, or it can just cause generalized abdominal pain.
Bloating is a huge
bloating,
one.
yeah. And a lot of the time, kind of the most common symptoms that I see of endometriosis are pain with sex, just pelvic pain ongoing without any real trigger, pain with bowel movements, sometimes pain with urination, and then definitely like super painful periods. Sometimes women have bleeding in between periods as well, but it's mostly pain. Yeah. And so when we think about addressing that holistically, there's kind of 3 different things that we think about looking at.
Sure.
One of them is actually addressing those implants and the adhesions and scarring that they can cause in the abdominal cavity, which is where you come in and do a great job. The other thing is addressing a kind of overdrive inflammatory response in the body, because that will cause that tissue to be really reactive and cause more pain. And then the other thing that we think about is making sure that hormones are in balance. So that tissue is really responsive to estrogen, and oftentimes we see that the balance of estrogen to progesterone is an issue. And even medically, we'll sometimes use progesterone or use progesterone birth control, those types of things, in order to help with symptoms.
For sure. Yeah, I think it's worth noting, just like you said, or reiterating, that endometriosis is a systemic issue. So it's not just something that is very local to just the uterus, and very much an inflammatory systemic disease that goes on.
For sure.
And that those little adhesions or those little implants, so that endometrial tissue that is often found outside of the uterus, is estrogen, both estrogen kind of receptive, I guess, or as well as estrogen producing, those little kind of implants. So the role of estrogen in that, and hormone, kind of just figuring out your hormones, is very important in that. So
and just to kind of speak to a specific example, probably one of the most severe cases of endometriosis I've ever seen was, I think she was 28-year-old lady who had come to us because she was having such significant pain with her period that she could barely walk for several days. She needed to use really heavy narcotic medication multiple times a day just to survive. Like, she still had pain.
Yeah.
Bowel movements were really painful for her. Obviously, sex was impossible for a significant portion of her menstrual cycle, which was really affecting her relationship. And so for her, she actually did end up doing a surgical procedure to help with the endometriosis.
Yeah.
But prior to the surgical procedure, we were able to use some herbs to help with progesterone production and some liver support and antioxidants, and also just working on minimizing inflammation in her body as a whole. That's to get her symptoms to the point where they were manageable before the surgery and actually didn't come back after the surgery.
Yeah.
Which it's really common for them to come back after surgery.
Yeah, for sure.
And so I think that just kind of demonstrates that there are things that we can do that aren't just birth control.
Yes.
To help with symptoms. Because oftentimes conventionally, while sometimes it's necessary, that's kind of one of the only options that's presented. But naturopathically, we do have a way to think about things a little bit more holistically.
We have just scraped the surface on endometriosis, and if you have other questions about it, or you're someone that has endometriosis, definitely reach out and to either myself or to Jen. And there's a lot of hope available.
Totally.
And it can be a very debilitating disease, but there's actually a lot that can be done for it that doesn't have to be just birth control.
Yeah, for sure.
So there's so much more that can be said, but we're let's talk for a second on birth control.
For sure.
So there's, I think, a lot more press coming out on how oral contraception is not your best, like not always the best option. I mean, it is an option for sure.
Yeah.
Where does one go? What do women do if they are not ready to or not wanting to support a pregnancy?
Yeah.
What's your best option for birth control?
Yeah.
If not the pill.
For sure. Yeah. And I think that honestly is a really complicated question.
Okay. Yeah.
And there is a lot of things that we think about medically, kind of whether somebody is a candidate or not. Things like what's their risk of heart disease? What's their family history of heart disease? Kind of what is their history of uterine or ovarian cancers or breast cancer, that kind of a thing that we think about. Yeah. And also just kind of how tolerant are you of needing to take a pill every day or that sort of a thing. Yeah. But I think what generally needs to be understood about birth control is just that it's all about pros and cons. And so I'm really just a huge fan of women making sure that they're making an informed decision about the different forms of birth control and what the pros and cons are. One of my favorite resources for that is a website called reproductiveaccess.org. They have tons of really great info about birth control and the different types of birth control, because there's so much out there that's not just a pill that you have to take every day.
Totally, yes.
And the pill is the highest dose of hormone that we use for birth control. Yes. Whereas things like the NuvaRing, which is a vaginal ring, or patches, or skin implants, or shots, all these different options, they tend to have different side effects, and they tend to have potentially lower doses of hormone.
Okay.
I am a big fan of sort of the set it and forget it methods of birth control for women, if they're feeling like that's something that they need.
Yeah. Who remembers all the things?
Yeah, and those are basically IUDs.
Yeah.
So they work great because you don't have to worry about taking men out or taking a pill every day. Yeah. And of course there are risks associated with IUDs as well, and some women don't like how they feel with IUDs, but generally I feel most people tolerate those progestin containing IUDs like the Mirena pretty well. And what's interesting about those ones is they don't always stop you from ovulating.
Right.
Yeah, so they generally just thin out the lining of the uterus enough that it can't support a pregnancy. Okay. So some women still ovulate and they still have hormonal issues on those birth controls. Sometimes they create hormonal issues for women. But if we're talking about our options there, then I think that overall, in terms of pros and cons, is a good one.
Yeah, I would agree.
Yeah, super effective. Yeah. And really the only ones that don't have hormone in them that we have for options are what we call barrier methods, like condoms, diaphragms, those kind of things, which they don't tend to be as effective. Yeah. But if you use them right, they can be pretty effective. Yeah. And then there's also copper-containing IUDs. Those don't have any hormone in them, but I just don't recommend them for women who already have lots of period pain or heavy periods, because that can sometimes make that worse. But yeah, there's so many different options. So I think really the key takeaway there is just talk to your doctor about what your options are,
Right.
because it's not just a pill.
Yes. Yes,
Yeah.
please. Yeah, totally. And that's
Yeah.
usually kind of the thing that is just presented, right? Oh,
Totally.
here's the pill.
Yeah.
So,
Yeah,
or
and-
especially for, I feel like, even adolescents and girls starting their period,
Mm-hmm.
that if they're having heavy flow or irregular periods, then, I mean, now we know that that's normal.
Mhm.
Like, for really those first 5 years, irregularities like that, or it's really just your body kind of finding its rhythm.
Mm-hmm.
But lots and lots and lots of teenage girls end up on the pill.
Mhm.
And really, that's a really important time for your body to establish a good rhythm and to be ovulating, learning how to do that. So,
Yeah, and when we see issues with women having trouble getting regular periods back after they stop a birth control method, the pill is one of the most common culprits there.
right.
Just because it is such a high dose of hormone, and it does really just take control of what your brain and your ovaries are trying to do,
Right.
which is why it works well. But we can see more issues with what we kind of call post-pill syndrome, where
Totally.
periods are irregular, they're not coming back at all sometimes after.
Yeah.
But I think the majority of women don't experience that.
Yes.
Of course, I just see all the women who experience
Right.
it.
Our population's a little unique.
Yeah,
'cause
but
there are
everybody
people
who
that
comes
are
off the pill and gets their period back right away, they don't have any problems to come
Yeah.
see me about.
That's
so.
true.
Yeah.
Okay, let's touch for a second on pregnancy, birth, and breastfeeding,
Mhm.
and how those things can affect a woman's cycle and her periods.
Yeah, for sure.
Yeah.
So, of course, I don't think it's any surprise to women that you don't get a period when you're pregnant.
Yes.
And that's a good thing, because we don't want that lining of the uterus shedding when there's a baby in there trying to grow who needs all of those nutrients and all that blood flow.
Right.
But the other thing to know is that if you are having something that you would consider a period or any bleeding during your pregnancy, that's totally something that needs to be checked out by your provider.
Yes.
Sometimes it's okay for that to be happening, and sometimes it's not.
Yes.
I'd say
Any
let's
bleeding.
err on the side of it not.
Get that checked.
So it needs to be checked. Yeah. So no periods when you're pregnant.
Mm-hmm.
And then it does take a while after delivery for those things to come back regularly.
Yeah.
So that is usually delayed. It takes longer for women's periods typically to come back if they're breastfeeding.
Can you explain why
Sure.
that is?
Yep. So when you're breastfeeding, your body makes a lot of a hormone called prolactin.
Yeah.
Which is pro milk production.
Yes.
And so if you continue to breastfeed, your prolactin levels continue to be high. And what that actually does is it stops your brain from sending the signal to your ovaries to make estrogen and progesterone and to develop those follicles.
Okay.
And so there are some very specific criteria that women can follow if they want to use breastfeeding as birth control. But it's not generally something that I recommend.
No.
Especially
So many babies made while breastfeeding.
I know. And
Yeah.
even if you're meeting all the rules and it's been, less than 6 months and you're exclusively breastfeeding and all this stuff, I still see women get pregnant.
Yes.
And
for
something to know is that, like we've already talked about, you have to ovulate before you have a period.
Yes.
And so women often don't know when they've started ovulating again.
Yes.
So theoretically, you could have your baby be breastfeeding or not breastfeeding, ovulate, get pregnant, and actually not have a bleed in between those two times. So it is really important to, be conscious about your birth control there. But so generally it takes at least a few months for periods to come back if you're not breastfeeding. And then if you are breastfeeding, sometimes they come back right away. Sometimes they are gone for the entire time you're breastfeeding. It's super variable. Yeah.
Normal is here when it comes
totally.
to period stuff when breastfeeding after childbirth.
Yeah, and sometimes the nature of women's periods will change too after they have a baby. That whole process tends to be kind of a big hormonal reset button.
Yeah.
So sometimes periods will be longer or shorter or heavier or lighter, and that's not always a problem. Right?
Yeah.
It can just be your new normal, but if it's something that you're concerned about, then definitely get it checked out. Yeah.
Awesome.
I was just gonna say what's really helpful. What's really helpful if you are gonna go get it checked out for your medical provider is if you can chart your periods.
Yes.
So if you can keep track of when they start and how many days of bleeding you have, then that gives us a huge help when you come to see us. There's lots of good apps you can do that with on your phone, but even just a good old day timer is helpful.
Great idea. Yeah. Okay. Anything really simple that women can do to help just support a healthy cycle, healthy hormone balance. So anything from like lifestyle to, I mean, you had mentioned having an estrogen friendly environment, but lifestyle to food, to stress, to sleep. Like, what can we do to help support our bodies in having a healthy menstrual cycle?
Sure.
Yeah.
So one of the things that comes up the most when we talk about a healthy menstrual cycle is PMS, or premenstrual syndrome. So either physical or emotional symptoms that women have prior to their period for a week, sometimes 2 weeks, that are really disruptive to their life.
Yeah.
So oftentimes my recommendations are geared at those types of scenarios. So I think something that is really important is to make sure that you're getting a good varied amount of fruits and vegetables in your diet.
Okay.
Those help support your liver in terms of processing hormones.
Okay.
And they also contain a lot of compounds called antioxidants that can be helpful. And they also just contain fiber and magnesium and all of these different nutrients that are really important for hormonal health. So just making sure that you're eating vegetables and fruit on a regular basis.
I love it.
And then dietary wise, the other thing that can sometimes help is mixing up your protein sources.
Okay.
So thinking about doing beans or even soy products occasionally instead of just sort of, you know, good old Alberta beef all the time, can help to make periods a little bit easier. And just because there's some plant components in those other proteins that can be helpful with hormonal balance.
Okay.
Exercise is huge.
Okay.
So exercising throughout
Right.
your menstrual cycle, we know that that helps to alleviate both physical and emotional symptoms that can come up before the period.
Yeah.
And that doesn't have to be anything crazy.
It
can just be a walk every day.
walking.
Yeah.
Yeah.
And then the other thing, nutrient-wise, that I often think about is magnesium.
Okay.
So there are some good studies that link low magnesium levels to women having more struggle with premenstrual symptoms.
From the pain perspective or the emotional side, or both?
Kind of both.
Okay.
Yeah. So
Good to
we
know.
think sometimes about either supplementing with magnesium or just getting more magnesium in the diet. So fruits and veggies, green leafies especially, and whole grains and nuts are the highest sources of magnesium in our diet.
So if someone was planning on supplementing with magnesium, because isn't there 2 types of magnesium?
There's a lot of different types of magnesium.
Multiple types. So what are you thinking when you're thinking about supplementing? Like what would you be looking at?
Yeah, so generally we kind of want to do anything that is going to be more easily absorbed by the body.
Yeah.
So the only kind of blanket recommendation that I have for that is that women avoid magnesium oxide if they're trying to get the magnesium more absorbed into their body.
Okay.
There's some debate about a form called magnesium citrate, whether that's easily absorbable or not.
Okay.
I use a form called magnesium glycinate because I find that it works well.
Okay.
And generally 200 to 300 milligrams a day is a safe, reasonable dose for most people.
Okay.
But of course, you know, if you have other health conditions going on or
Maybe
have any questions about it, then I'd talk to your doctor about a recommendation there.
Okay.
But yeah, magnesium's a pretty easy one to find. And you'll know if you're taking too much because you'll get loose stools.
Right.
Yeah.
Yeah.
And you'll know. It's not subtle.
There's no question on that one.
Yeah, for sure.
Awesome.
Yeah, and then I think the other thing that's really important is just to know that your plate is going to be smaller before your period. That it's normal for us as women to feel less productive, have less sex drive, to feel a little bit more fatigued, and sort of just be more inward and quiet before our period. And there's normal hormonal reasons for that.
Right.
But our culture doesn't really allow for that. You know, it demands that we stay at the same level of productivity the whole time.
Totally.
And like when you're ovulating, usually women feel great. They have tons of sex drive, they have tons of energy, they're just feeling really good.
Yeah.
And so I think just knowing that it's okay to slow down a little bit before your period, it's okay to need to take care of yourself a little bit more, can kind of eliminate, or not eliminate, but just calm down some of that suffering emotionally that can happen when we feel like we have to keep push, but our body's telling us to slow down.
Yeah. That's a great point.
Yeah.
Love that. Okay. Okay. I might just skip the next one because of time here, but so you had mentioned that one resource, reproductiveaccess.com. If women are looking for more resources on periods, or anything to do with what we talked about, where can they go?
Yeah. So there's tons of information out there about periods, but
Yes.
it's just finding the good stuff.
We would prefer the reputable evidence.
Yeah. So I'm definitely available.
Yeah.
If women have questions or
awesome.
if they have issues and they want to come discuss what their options would be naturopathically with me, they can definitely, call Aspire and make an appointment and come to see me. Or we have 3 other licensed naturopathic doctors that work in that office. And we all tend to focus more on sort of combining the best of conventional and alternative medicine.
Yes.
So really my goal when I see women about this stuff is to just talk to them about all of their options and what the pros and cons are.
Yes.
And help them make a decision about what's going to work best for them.
Mm-hmm.
So you don't have to quit your birth control or do anything like that before you come and see me. We'll talk about it.
For sure.
I think we've talked a little bit about Aviva Ram before. So Aviva Ram is a medical doctor and a midwife who is a great source of information on evidence-based herbal medicine and nutritional medicine, specifically for women and kids.
Yeah.
And so I think her website is just avivaram.com. And she's got a great blog and a podcast.
Her podcast is Aviva Ram Natural MD Radio is her podcast, and I listen to it a ton. Great resource.
Yeah. She's a really great resource. Of really balanced, knowledgeable, safe information. She's great. And then the other thing that I think is a good resource for women, especially who have daughters and are wondering about how do we talk to our daughters about periods and all this kind of stuff, is a book by Hilary McBride called Women, Daughters, and Body Image, or Mother, Daughters, and Body Image, I think it's called. And I just really love that book and her work because she talks about how the way that we talk about and view our bodies as mothers or as women, right, who have younger women in their lives. You don't have to be a biological mother to be in that group. Yeah. But the way that mothers talk about their bodies, when we look at their adult children, those women tend to talk about their bodies using almost the exact same words that their mothers used. So if you've got a teenager and you're not sure kind of how to help her have a healthy body image, I think that's a really great resource to start with to understand how the work that we do on our accepting and loving our own bodies can really impact our kids and how they view their bodies as a whole, not just their periods, right? And then other resources, we talked about reproductiveaccess.org. Really, there's some great sort of textbooks out there, but of course that's probably not something that women are going to be reading.
A good textbook?
Yeah. And then the other place that I like to send people for information about birth control and just hormones in general is a website called bedsider.org. That's a great resource for younger women. Yeah.
We have a favorite here, Lara Bryden. I don't know if you've heard of Lara Bryden, but Lara Bryden has a website, Lara Bryden. I feel like it's LaraBryden.com.
I have to put it in the notes.
Yes, I will find it. But she's a great resource on periods as well.
Yeah, and then also anything by Tori Hudson. So, Tori Hudson. She's a naturopathic doctor based out of, I think, Oregon. And so she's got really great information regarding women's health and that whole, thing. So, there's a lot of good resources out there for sure. It's just knowing who to look to.
And I think, as with so many of the topics that we've already talked about, education is really power, right? And I think historically, periods haven't been something that we've talked about a lot. It hasn't been something that we've had open dialogue about. Therefore, the care that women getting, I feel like, is fairly narrow in the approach of care for women with period concerns or any other hormonal concern. So education really is power, and it also, when you're educated, it really helps the fear part go down, right? So, I think that's a great kind of ending spot, is really just, I love what you said about just being informed and then making your choices regarding your hormonal health in an informed way. So it's not like there's cut and dry good bad at all. No. But just having the information so that you can make a good choice for you is really good. So you can find Dr. Jenn Pilon at Aspire Natural Medicine, as well as the other team there are really great resources in our community.
We do have a website. It's aspiremedicine.ca.
Awesome. So,
Just the way it sounds.
awesome. Thank you so much.
Yeah, thanks for having me. It was
joining
great to
me
talk
and-
with you about periods.
We could talk all day about
Yeah, I'm sure we
periods.
could. I do talk all day about
True,
periods.
true.
Yeah.
Awesome. Thank you, Jen.
You bet. Thanks.